insurance companies in the state for a while. I worked for the Department of Insurance, and there's in the individual market in Missouri, and some of you have to buy your coverage as an individual. It's very expensive, and one of the reasons it's expensive is because when we allow companies to rate you differently or deny you coverage for a pre-existing condition, or rate you differently because of your gender or other health status indicators, then all of the administrative costs for that are built into your premium. So if you go in as an individual, it's going to cost a lot to look at your history, look at your application. There's a lot of people who will look at that, and then on the claim side, when you have a claim, if you got coverage, they're going to look at that all again. So the administrative cost sometimes for individual insurance companies is about 40%, which is extremely high. And as you said, Steve, compared to Medicare and even Medicaid, that's 3 times as much, I think, on the administrative cost. So some of the provisions in this bill are really going to cut down on administrative costs in insurance companies.
Thank you. I'm getting the 10-minute warning because I've got to go catch a plane. So I'm going to try to get in. We'll try to move these as quickly as we can. There's one question that this is from a doctor in the audience. What are we doing to increase the supply of doctors so the cost comes down? Are we increasing residency slots for doctors each year? And one of the things I want to point out in the bill, particularly with regard to primary care doctors and nursing, is that we need to have a new set of incentives for scholarships, loan repayments, and other incentives for them to locate in underserved areas. It's going to be a key component because in recent years, as we all have seen, many doctors coming out of school are going into specialty areas where they can potentially make more, and they're avoiding going into general practice. So there's a shortage there, but it's absolutely critical to have those primary care docs for basic access to our healthcare system. So I want to ask Dr. Wolf to speak to that and any others that want to comment.
Well, just briefly, I totally agree with that. If you come out of medical school owing $150,000 or $200,000, are you going to be a pediatrician? Probably not. And or you're going to be an internist, and you see all the not pediatricians but internists becoming boutique doctors. I mean, they're just tired of working really hard, not making any money, but I mean, that's not right. My last 2 great physicians were very professional people, and they just quit, and they are boutique doctors, and I don't believe in that, so I have to find a new doctor. But it's very hard for me to find a new doctor too. So I really think we need to get the incentives straightened out. But we have a lot of goofy, we say one thing, we do another. Like, for instance, Americans, a lot of Americans don't want to go to their primary health provider for a headache. They want to see a neurologist. And that increases healthcare costs. And it's not smart, and it's not efficient use of dollars, but people want those kind of choices. So we have a lot of national discussion, I think, that needs to go on, along with incentivizing people to actually be primary care physicians.
The bill also includes increased funding for our community clinics, our federally qualified health clinics. I see Dr. Janetta Craig here from Family Health. These are important clinics that can only locate in medically underserved areas. Except for a few physicians like Dr. Wolf, they are the only source of primary care in the inner city here in St. Louis and in rural areas throughout Missouri. They offer not-for-profit care, they offer support services, they offer transportation, mental health, important new infrastructure funding for their services, and also loan forgiveness for them to be able to attract the primary care physicians they want, and important things throughout this bill.
Thank you. Let's go to the front mic. Yes.
I'm going to be... My turn. Hi.
All right. Back mic first.
Hello. Thank you so much, Congressman, for allowing us this time. Dr. Wolf actually asked my question, and you did answer it. But the question I have for you directly is, have you actually read this bill?
Yeah,
And your members of the panel?
The full bill that has gone through 3 different committees is not actually the bill that's going to go to the floor. So I have read summaries of the bill from all the different committees. The actual bill that I will be reading, and I would recommend that all of you read as much as you can, is the bill that we expect to be filed next Monday. That will be the bill after negotiations throughout this week that will actually come up to the floor for debate. So again,
So the bill
watch for the bill. The bill after negotiations this week will be filed, as we've been told, will be filed next Monday, and that is what will be coming up to the floor next Wednesday.
Okay.
Thanks very much.
Okay, so just make sure that before anyone vote on the bill that it's actually read and we know the details. And there was also a comment with someone on the panel, you're asking about other healthcare options. And there's been several other healthcare options in Congress, but for some reason they are not being considered. So we need to look into that. And you also talked about budget cuts. And one way I think we could do that is look at your litigation. You know, we can cap litigation and also look at the public option that someone did mention. Look at your public options.
Thank you very much.
The AMA and ANA, they did endorse this, but they're in Washington. I am a registered nurse. And average nurse, doctor, no, we do not support this. We feel that patient care will be jeopardized. And I'm concerned about patient care rationing also. Thank you.
Thank you. So real quickly, so we're one and done at a time. That's fine.
I wanted to ask you about the Mental Health Parity Act that was passed recently. Is this bill going to require that companies or insurance plans follow that or comply with that law?
That's my understanding, that it would be part of a benefits package, whether for private plans or the public plan, to be part of the exchange, that would have to be part of their basic benefit plan to include mental health coverage.
Thank you.
Yes, thank you. Yes, ma'am.
Hi, my name is Mary Jo Feldstein.
Oh, I'm messing up again. I'm sorry.
My name is Darnell, and I'm a Marine veteran and educator. And I'm a proud parishioner of the Congregation of America and the world. So my question is going to go beyond the localized of just America. My question is going to touch on education, healthcare, and security. With the current status of what we're being measured on in the world court, with the current conviction of Charles Taylor, the Liberian president that got convicted of war crimes, when are we going to start holding our healthcare representatives of Congress and the Senate accountable for what they voted for in the past? I know the president said he don't want to go back there too far, but what has happened with Charles Taylor, with investment of into his government, he was doing a lot of human rights violations. And when we're going to start regulating our representatives on that point of abiding by the rule of law, which is democracy, the Constitution, the people, and the international laws that govern our congregation around the world.
I appreciate your comments, and I'd be happy to, if you could follow up with my staff. I'd like to get more information on your question, but we're going to stick with some more healthcare questions because we're almost out of time.
Okay.
Okay, thank you. Yes, ma'am.
Hi, Congressman. My name is Mary Jo Feldstein. I work for the St. Louis Area Business Health Coalition. We represent 40 large St. Louis employers, Boeing, Monsanto, Ameren, those folks. As we've established here today, healthcare is really unaffordable for most folks, whether they have private coverage or not, particularly obviously if they don't.